All right, Governor, you ready to go?
Wait just one second. Let me give my phone to Rebecca.
Yep, take your time. All right, sounds good.
Hello, everyone. It's Wednesday, May 17th. Joining me today, I've got the Secretary of Tourism, Chelsea Ruby, with me, and the State Health Officer, Dr. Matt Christiansen, is also with me. So we've got some neat stuff to talk to you about. The first one, Chelsea will do a great job, telling you more about this. But let me just read this first sentence to you. Today, I'm beyond excited to announce that the New River Gorge has been named the best family trip in the U.S. by Outside Magazine. And Outside, selects one winning destination and one runner-up, for various travel categories and everything. Chelsea's going to come on and tell you a whole lot more about this and tell you all the distinguished magazines and newspapers or whatever it may be all across the globe that have looked at West Virginia and cast a great opinion about West Virginia. So Chelsea, come on and tell us more about this. This is great stuff.
Good morning, Governor. Thanks for having me. Super excited about this. We have had a lot of celebrating over the last couple of years with these big publications labeling West Virginia as a top destination. So just in the last year or so, we have received similar accolades from Travel and Leisure, Condé Nast, Lonely Planet, Frommer's, Time, CNN, USA Today, and today I am so excited to add Outside Magazine to this list. So for those of you who may not know Outside, they are the premier publication for outdoor enthusiasts. They have over 50 million in reach each month. So this is a big deal. We are excited to continue receiving this national and international recognition for what you told us all years ago would happen, is that people would start saying that West Virginia is the top destination. So we're excited, and we'll keep going. We've got a couple more publications we haven't gotten yet, but this is one that we worked really hard on, brought their editors here several times. I've gone out and met with them, and we're excited to see that they now know what all of us here in West Virginia know, which is that West Virginia is truly almost heaven.
Well, Chelsea and all those that have put in the licks, whether it be through all the different departments, I can never thank you enough. This is really great. I mean, I've said it so many times in so many different ways, even when I flashed Baby Dog's Heine, at Bette Midler at the State of the State. Really, there's so many people that have cast stones and looked down their nose at West Virginia, as thinking that we were the people that were behind or backward or not very well educated or poor or whatever it may be. And absolutely, we've all known just in West Virginia just how great this incredible state is and how unbelievable our people are. And so the one thing you're never going to be able to take away from me is I am really, really proud of who we are in this great state and all there is to think about and see and do and visit and everything else about this incredible state. So this is just another stepping stone that is an incredible, incredible, accomplishment. And so for all those that put in the licks and everything, to just absolutely get people to open their eyes and see we are that diamond. We're that diamond in the rough that everybody missed. We are frogs that are proud of our pond. But I tell you right now, absolutely, with all the folks that are coming, they're proud of our pond too. And so really, really good stuff. And so congratulations to everybody. And Chelsea, what an incredible job you're doing. And I'm really, really, really proud. Really, really proud. Good stuff. Let me switch channels with you and say that Monday, June the 19th is Juneteenth Day, a day that celebrates the ending of slavery in the United States. And in recognition, I have declared Monday, June 19th, as a state holiday for all state offices, and all state offices will be closed. So an absolutely great day, a great day of celebration and everything. And there will be a free event that will return to the Canal Boulevard side of the West Virginia Capitol Complex on Saturday, June the 17th, from 5 to 9 p.m. Just really, really good stuff. And we should celebrate this day. And so the way I think it's worked out, with West Virginia Day on the 20th, we'll get a real long weekend for great state employees that are very deserving and put in a lot of great licks every day. So let's celebrate that day. Dr. Matt Christiansen is going to be with us and talk to us about water and water announcements. And, so Matt, come on and talk to us about all this. You know this way, way better than I, and I could read through some notes and tell you some opinions of mine, but tell us the stuff, please, Matt.
Great. Well, thank you, Governor Justice, for bringing attention to this really important issue of water quality. We're going to talk a little bit about PFAS, which is a group of chemicals that has been in the news lately and something that's been on a lot of people's minds. But first, I want to go and tell you about a couple water facilities that I toured on Monday, just this week. On Monday, we traveled around the state with our staff in the Bureau for Public Health, who are all very committed staff committed to protecting public water and water systems in the state of West Virginia. And we met with Brent Clark and John Lipke at the Mason County PSD up on Crab Creek, Route 2. We met with John Jarvis and Jennifer Traub at West Virginia American Water here in Charleston. We met with Brian Arthur and David Simons at the City of Ripley Water System and Jeff Miller and City of Milton. And they are dedicated public servants that come to work every single day, committed to ensuring that when you turn that water on, that clean, quality water comes out. And I want to thank them for their service to the state of West Virginia and to public health. They're really knocking it out of the park. And in every single small town and big town and city in West Virginia, we have similar dedicated public servants and water operators doing that same work. And Governor, as you know, we're blessed in West Virginia with abundant water resources and amazing for recreation, as Chelsea was mentioning, and in the New River Gorge and other areas. But also, we're blessed with great people, and these people are really committed to making sure that, again, when we turn that water faucet on, that amazing quality water comes out. Now, PFAS is a group of chemicals that we've been keeping an eye on at the Bureau for Public Health for quite some time now. And they're used in things like fabric, in clothes, carpets, cookware, in firefighting chemicals. And the science over time has really developed, and we're learning a lot more about some of the negative health impacts of those groups of chemicals. Now, West Virginia isn't unique in being impacted by some of these chemicals. This is a problem across the country. But we've been ahead of the curve. And Governor, with your leadership, the Bureau for Public Health and DHHR and DEP have convened work groups on a regular basis with public water systems to make sure that we can measure and have plans with regards to when these regulations are coming out through the EPA. And the EPA just recently put out a series of recommended regulations for public comment that would limit the amount of 6 of these chemicals in our public water systems. We've been working on this since late 2019, and we identified first off around and tested more than 279 public water systems in West Virginia. Among those, we had 37 that had detectable levels of PFAS in the raw water, so that's the water before it's been treated, out either in the river or in the groundwater. We tested those again in the finished water and found that 27, so we started out with 279, we're now down to 27, had some detection of PFAS chemicals in their finished drinking water. That's the water that makes it onto the public water side. And then of those 27 systems, we had 19, so we're from 279 down to 19, that had one level that could potentially be impacted by these EPA regulatory standards. It's important to understand that these numbers in and of themselves, which we just recently released, are very low numbers in the parts per trillion range, and they're early and they're preliminary. These numbers in and of themselves are not enough for us to say whether a treatment facility needs to have treatment or mitigation just based on one measure. Now, many people want to know, is my water safe? That's the biggest question I asked when I read these numbers. I looked in my, where I have my twin 4-year-olds, I want to make sure that the water that they're consuming is safe. These health impacts are not immediate. They accumulate over time, and the Bureau for Public Health has not issued any health advisories, and we really are ahead of the curve even when thinking about our response relative to other states. The water that you get from your faucet has been and remains one of the safest water sources out there. It's purified and quality tested by these heroes, these public servants in your local communities at your public service districts. West Virginia will be in receipt of almost $19 million in the first round of funding to help us mitigate some of these contaminants, and we anticipate more over time. And this funding can be really used for a wide range of activities, from research and testing, treatment, source water activities, restructuring, consolidating if needed, creating new water systems, and technical assistance. We're working, again, very, very closely with the DEP and these water systems to identify potential sources. This is very preliminary, and we put this data out there to make sure that we are being as transparent as possible, and we're putting that information out to the public just as we have it. And so more information will certainly be coming about the mitigation process and strategies going forward and the resources that will be available. But I want to thank you, Governor, for your leadership in pulling us all together and making sure that we're all rowing the boat in the same direction here.
No, Matt, thank you, and what a job this young man's doing and for all of us, and making things safer and better for each and every one of us every day. And so, Matt, we thank you, and just keep up the great work, and anything and everything we can do to just continue to make things safer and better for our great people of this great state, we're going to absolutely do it. Now, if I could switch channels with you to something that we did day before yesterday on Monday. We were doing a groundbreaking at another new school. This is going to be Timberwood Elementary School, and it's going to be in Mercer County. the day was a little messy and everything. We had a little bit of rain, but we thank the God above for the rain and the goodness that comes from rain. And so, other than it being a little muddy and a little bit wet and everything, and me, bumping in with my vehicle to the generator that was sitting on the ground and knocking it over, everything went really, really smooth. And what a great day for Mercer County. This elementary school is just going to have just short of a total of 400 kids at the school. It's going to have its own gymnasium, which is a real upgrade. It's going to. This is the combination of Brush Fork Elementary and Bluewell Elementary. I just think there's just great stuff going on in Mercer County, and I'm just proud to be a part of it. And the other thing I want to point out and everything before I go any further here is, I think if you could just zero in to the fellow that's sitting beside a baby dog, that's our superintendent of schools and everything, David Roach. And you'll notice that David has a real manly look going on today in that picture and everything. He's got his little blue booties on to keep his shoes from getting the least little bit of mud on them. And he's got his little umbrella in his hand and everything. And the reason I tease about this is just this. David and I played golf for Marshall University. We were on the same team together and everything. And I told him, I said, David, now come on, we got to be a little tougher than this, because we played in the god-awfulest weather from time to time that you can imagine, because we played golf in the spring, and absolutely always we got going full throttle the last days of February, early days of March, and we played in some pretty tough stuff. But that's a good man right there. He's doing a great job. We salute, and we're really happy for Mercer County. Andy Neptune's right there, and Andy's doing a great job as well with the SBA. So let's just keep doing good stuff, and I congratulate everybody. Thank you so much. Okay, I guess we've got a video update on COVID. As I promised you, we'd do this, at least once a week and everything. And so we have a recording from Dr. Marsh, if you could show that, please.
Just to make sure that I point out that I'm recording this update on Tuesday, May 16th. So we have come in West Virginia and our country and even our world to the end of the emergency public health response. And in the United States, that ended May 11th. And even though we have ended the public health emergency in our country, it's important to be still cognizant that COVID-19 remains a serious infectious disease challenge and still is causing around 1,000 deaths per week. And that's notable because with the tools that we have today, COVID-19 really should be a preventable cause of death for most Americans and certainly for most West Virginians. And just as a reminder, we know that today that COVID-19 has its most severe impact in our older citizens. People 65 and over account for about 90% of all the deaths of COVID-19. And so we want to make sure that people who are 65 and older pay attention to getting an updated COVID shot. And also people who are immunocompromised, people whose immune systems are impacted by treatment for cancer or treatment for other kind of immune problems like rheumatoid arthritis or others, they are at risk as well. And the Centers for Disease Control and the FDA has now approved the updated COVID shots. to be given again if it's been 4 months from the initial updated COVID shot for West Virginians and Americans over 65 years old, and after 2 months if people are immunocompromised. And although that might be confusing to some people, we, as always, would direct you to our vaccine tool, which is at vaccinate.wv.gov, our vaccine calculator. And also now with the end of the state of emergency, we would also encourage you to go to the testing tab at the top of that page, again, vaccinate.wv.gov, which will give you insights into the places that you can still get tested and also the resources that you still might be able to get tests through. So again, the vaccinate.wv.gov both has the vaccine calculator and also the testing tab. Now, as we look at the end of the emergency for COVID-19, we continue to learn more about the virus. We know that, for instance, people who are obese, people who are well above their ideal body weight, might have a reduced benefit from the vaccine as far as not being able to generate as much of an immune response to protect themselves. And they may see the immune response from the vaccines go away a little bit quicker. So it's important that if you are in that category and you have already had a updated COVID shot, or you're planning to get one, you might want to talk to your healthcare provider to make sure that you are getting the best result from that, and that it's possible that they may recommend you to get a follow-up COVID shot in the future after that, because of this new information that's coming out. We also know that there's more evidence that long COVID, the continuing effects of COVID-19 that last months after the initial infection, may be caused by the still presence of some viral particles in the body. And this is important because we know that two really important ways to reduce your risk of developing this disease, long COVID, is by staying up to date with your vaccines, but also by testing yourself if you have symptoms of infection and making sure that you are notifying your healthcare provider if you test positive, because the antiviral medication Paxlovid reduces the risk of long COVID from getting acutely infected with COVID by 26%, no matter what your age is. So Paxlovid is really an important drug to reduce the severity of COVID-19, and that may be most important for our older population and our immunocompromised people. But in fact, it reduces the risk of developing long COVID in everybody. So if you're over 18 years old, then it still would benefit you to consider taking Paxlovid, which needs to be taken within the first 5 days of being diagnosed with COVID-19. And I would also say that it's very important for us to make sure we remind each person in West Virginia that, again, even though the emergency response has now been stopped in the United States, COVID is still an important cause of problems and illness and even death for a small number of people. And we currently, with our updated vaccines, our updated COVID shot, as well as the medications that we have available to us, we can prevent COVID-related deaths in almost everybody. And as we look at this response, that we still want to make sure we're protecting all West Virginians, I just want to take a second and looking back at this whole experience we've had for the last 3 years, to recognize the governor's leadership and his ability to lead us through this incredibly unusual and unique period of time in our country and our state, as well as our entire leadership team and all the people who serve the state of West Virginia, from the healthcare providers to the first responders to the essential workers to really everybody else. And although there's always opportunity for us to do everything better, I am just so proud of the way that our state did, as the governor said, pulled the rope together and ran to the fire and helped each other, because that's what West Virginia people do. So I really appreciate being on this update with you, and I wish you the best of health. And please still pay attention to protecting yourself, because by doing that, you protect everyone.
Dr. Marsh, thank you again, and thank all my team, every last one of the great West Virginians that did run to the fire. They did pull the rope. We all pulled the rope together. You know, it could have been really, really, really tough. It was surely tough enough and everything, but I'm really proud, really, really proud of how everyone jumped in and did what great West Virginians do. And so, you know, I like you, I'm very, very thankful to everyone around me that, you know, made this a whole lot better than it surely could have been. If I could switch channels a little bit, another bit of good news in West Virginia is our unemployment rate ticked down to 3.3% in April of 2023. Total employment climbed almost 1,000 more people in West Virginia. The national average is still slightly above us. They're at 3.4, we're at 3.3, and so good, great stuff. Let me tell you this, you know, for those of you maybe in the northern part of the state or eastern panhandle, you may have not known this fella, and you may have not known him hardly at all. But we lost the Senator Billy Wayne Bailey. And Billy Wayne in southern West Virginia was known as a friend to all. And you know, when the news came across, it surely saddened me. I knew him very well, and you know, it just like I said, he was, in his own way, he was a legend in southern West Virginia. He served in the Senate from 1991 to 2008. He also served as the Deputy Secretary of the Department of Veterans Assistance from 2011 to 2019. I'll be issuing a proclamation that'll lower our flags in West Virginia in his honor once we get an update on when the services are going to be set. But keep him in your prayers. You know, while in many ways, you know, I didn't know the family, but I always knew of Billy Wayne from the standpoint of, like I said, you know, in my neck of the woods, you know, Billy Wayne was a legend, and he'll be remembered and he'll be appreciated for decades to come. So Billy Wayne, we thank you, and may you rest in peace. And we lost him way too young, 65 years old, I think. But nevertheless, that's all I've got right now.
All right, thank you, Governor. Let's now turn to members of the media for questions. We'll start with Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is for Dr. Christiansen. You know, you said that the drinking water in these communities is safe, but you also talked about the long-term health effects. So are there any steps that folks in these communities need to be taking in the short term or the long term to mitigate those long-term health effects? Thank you.
Matt, please talk to us.
Sure, and thank you for that question. I know a lot of people are wondering about these health impacts, and again, just to reiterate, These are long-term health impacts. If these were immediate, acute threats to people's health, we would be issuing do not consume advisories and other consumption advisories. And at this point, we're not doing so. These are very, very low levels, and the impact is really something that accumulates over time. For individuals that are concerned about their potential exposure, number one, I would encourage them to look at the map on the Bureau for Public Health, Office of Environmental Health Services website, which has the most updated testing numbers. But I also want to remind people that these are very preliminary tests. These are numbers that do not indicate whether a system needs treatment or not. These are really us getting ahead of the curve even before these federal regulations are going to come out, probably by the end of this year, and have to be implemented within a few years. So these aren't enough to tell us whether we need treatment or not. We're going to have to continue to test and get more information. For people that the next step is if you are in one of these potentially impacted systems, you could install a home water filtration system that is or under sink or in refrigerator system that is rated for PFAS and PFAS filtration.
Okay, well, thank you, Charles. Let's now go to Randy Yohe with West Virginia Public Broadcasting.
All right. Thank you, and good morning, all. Governor, a quick question following Dr. Marsh's words of wisdom. After more than 2 years of urging West Virginians to get their COVID-19 vaccines, even saying it's foolish to not get your shots, you said something in last week's briefing that seems to be to the contrary. You said, in this day and time, with the information we have, the group I've worried about before that did not get vaccinated, they may very well end up being the group that is safest and healthiest. It seems contradictory. What do you mean by this day and time with the information we have, and how should one interpret this about-face statement?
Yeah, I hope to goodness that it's not interpreted as an about-face. Here's what I always try to be really fair. And through all of this, we surely, and I would do the same thing tomorrow. And I want you to understand that. I would encourage people in every way, because the science of what we were told at the time was to get vaccinated, to get your booster shots, especially if you were over the age of 50, over the age of 65. Get vaccinated and get your booster shots. And I encourage people to do that. And if I had to do it all over right now on the information that we had, we absolutely should have done that, and we did do that. I do believe it saved a lot of lives, without any question. But now, today, with a community that is vaccinated, what would we have done really and truly if we had no one vaccinated? This thing would have probably run rampant across the land. Now, there's much information that continues to come out. We want to listen to the information. But based on what we had at the time, without any question, what we should have done was get vaccinated. And we did that. And literally what happened then is you had a community that was completely vaccinated, and then you had people that were getting some level of natural immunities. We were told in the beginning that the natural immunities was just a smoke and mirrors deal. And now we're told that the natural immunities, once you had COVID, are real. And so Randy, this has surely been a big time moving target. I didn't mean to indicate that people that didn't get vaccinated did the smart money and the smart things. But today, really and truly, I said in the briefing, and I'll stand right by it. I was vaccinated 4 times, I think. I was boosted twice. I had COVID 2 different times. But I didn't say in the briefing, but I'll say it right now. I believe with all in me, if I hadn't been vaccinated, it could have been really, really, really bad. And so with all that being said, my personal beliefs are we should have been vaccinated, we should continue to vaccinate, and we should continue to take booster shots upon the advice of your physician. That would be my personal belief. and it would not change in any way, but there is information that people that maybe didn't get vaccinated, that got COVID and everything, there's information out there that we should look at and learn from. And that's just all I'm trying to say.
All right, thank you, Randy. Let's now go to Marley Pinchok with WSAZ.
Thank you so much for your time. This question is for Dr. Christiansen. One of the areas with those elevated levels of PFAS is New Haven and Mason County. I spoke with the mayor and New Haven Water Department. They tell me they already have a property cleared out to install a new carbon filtration system. They also tell me they've been in contact with contractors who will be doing the work. All they need right now is the money to do it. I know the state is getting about $19 million in federal funds, which can be used several ways, including treatment. When can New Haven expect to receive that money so they can start working to get those chemicals out of the water? And is there anything people in New Haven can do now to protect themselves? Thank you.
Matt, please go again.
Sure, thank you. So with regards to the funding, we anticipate this will be the first of multiple resources that we can help assist water systems with. Again, our goal was to get this data and this information out there as quickly as possible, and so we don't have a dedicated time frame right now for when those federal dollars will flow, but you have my commitment and the commitment of the work group that we put together to get that moving as quickly as possible. We have been already working on these issues with DEP and DHHR as well as water systems to make sure that we are ready to hit the ground running if and when that money starts to flow. But we do anticipate other resources to come down the pike. With regards to things that individual consumers can do, again, I want to emphasize that this is a long-term issue. This is not an acute threat to anyone's individual health. And if it were the case, we would be putting out other do not consume orders or health advisories on these issues. So this is a long-term exposure issue, really, that we need to mitigate over time. If people do have particular concerns, they can look to those in-home systems that are rated for PFAS contamination.
All right, thank you, Marley. Let's now go back to Governor Justice. Governor.
Okay, well, I guess in conclusion, I would say this, the briefing, first of all, thanks to Secretary Ruby and thanks Dr. Christiansen for coming on and everything. You give incredible insight. Dr. Marsh, your report was fabulous. But I would just say this, for West Virginia to receive this award from Outside Magazine to designate West Virginia, the New River Gorge, as the best family destination is unbelievable. And that again, is another notch of being really, really, really proud from my standpoint. So a lot of great work by a lot of people, and we want to just keep that going. We absolutely want to celebrate June 19th, and as Juneteenth Day, and a day that is so profound in all of our lives. Dr. Christiansen went over all the stuff in regard to water, and we were able to open up a new or break ground on a new elementary school in Mercer County. It's really, really good stuff. I celebrate, our unemployment rate, and I ask you for your prayers for Billy Wayne Bailey. A good man that touched lots of lives and everything. And every time I saw him, he was upbeat and a big smile on his face. So, Billy Wayne, keep doing the great work up in heaven right now. And God bless you in every way. That's all I've got.